Statins are among the most widely used drugs in the world to reduce cholesterol and triglyceride levels in the blood. In recent years, however, several questions have been raised about their possible side effects and the health impact of long-term therapy. Are statins really that effective? What risks do they hide? Let's find out together. Statins are a class of drugs that reduce the endogenous production of cholesterol by the liver by inhibiting the action of a key enzyme involved in its synthesis. They are used both to prevent cardiovascular events in high-risk patients and to reduce the likelihood of recurrence in those who have already had cardiovascular problems. Taking statins has been shown to reduce total cholesterol by 30–40%, specifically decreasing levels of bad cholesterol, while it may leave good cholesterol unchanged or even increase it. In addition, statins also affect blood triglyceride levels, but with a more modest effect, reducing them by about 10%. These two lipids, cholesterol and triglycerides, if present in excessive quantities in the body, begin to deposit along the walls of the arteries, forming what are called atherosclerotic plaques. Over time, they cause a thickening and hardening of the vessel walls. As they increase in volume, they obstruct blood flow, favoring the development of cardiocerebrovascular diseases such as myocardial infarction and stroke. Statins, therefore, reduce the accumulation of cholesterol and improve the blood lipid profile, as well as reducing the production of inflammatory markers, such as C-reactive protein and interleukins. Various clinical studies have shown that statins are able to stabilize the atherosclerotic plaque and even make it regress in a relatively short period of time, thus reducing its probability of rupture and therefore of related cardiovascular diseases. Statins are generally considered safe and well-tolerated drugs, so much so that they are among the most prescribed medications in the world. At the same time, however, they have often been associated with several unwanted side effects. Among the most common are muscle pain, which occurs together with soreness, night cramps, and muscle weakness. However, a study published in the well-known English journal The Lancet has shown that most of the muscular symptoms associated with taking statins are actually due to the so-called nocebo effect. This is a pathological response of the organism that is not caused by the effects of the drug, but by the negative expectations that the patient has towards this drug. Reading the adverse effects listed in the package inserts or consulting unreliable sources of information can contribute to amplifying this effect. The study concludes that in over 90% of individuals who present with muscle symptoms, the cause is not attributable to statin use, especially if the treatment was well tolerated for a year before developing symptoms. The risk of developing muscle symptoms is far lower than the known cardiovascular benefits, which remember contribute to significantly reducing the probability of heart attacks and strokes. However, this does not mean that muscle symptoms should be ignored or underestimated, so it is important to always consult your doctor. In this case, it may be necessary to measure the levels of creatine kinase in the blood, an enzyme present especially in skeletal and cardiac muscle tissue. If the values were to be 5 times higher than normal, the doctor could indicate the temporary suspension of statins and prescribe a lower dosage once the creatine kinase levels have stabilized. Some concerns have been raised about statin use and its effects on liver health. Among the most common adverse effects, most frequently seen in the initial phases of therapy, and in only 3% of patients, we find a symptomatic increase in transaminases. These are enzymes that are found mainly in liver and muscle cells and are involved in the metabolism of amino acids. However, according to a study conducted at the University of Nizwa, the increase in transaminases is attributable to the alteration of the cell membrane of liver cells and their consequent loss of enzymes, rather than direct liver damage. Hepatocellular liver damage is a rare complication of statin administration and usually resolves within 6 months of stopping the drug. The risk of serious liver damage, such as acute liver failure, is very low and has been estimated at around 1%. A systematic review conducted at the Laboratory of Clinical and Experimental Physiopathology in Rio de Janeiro found that statins not only reduce cholesterol levels, but also improve inflammation, fibrosis, oxidative stress, and microcirculation in non-alcoholic fatty liver disease, also known as fatty liver, but also in non-alcoholic steatohepatitis. According to the results of another study, published in the Journal of the National Cancer Institute, taking statins is also associated with a reduction of nearly half the risk of liver cancer. This is because experts suggest that the reduction in serum cholesterol may influence several signaling pathways involved in carcinogenesis, the process that causes healthy cells to transform into cancer cells. Although statins are promising drugs for the treatment of liver disease, not all studies have shown consistent and conclusive results. Further research is needed to better understand their true hepatoprotective benefits and potential adverse effects, especially in patients with advanced liver disease. As the Italian National Institute of Health reminds us, the use of statins is not recommended for people with serious liver disease or in cases where a liver problem is suspected, evidenced by altered values in blood tests. Before prescribing these drugs, the doctor will have to carefully evaluate the results of the tests to check the health of the liver and indicate the medical tests to be performed, 3 and 12 months after the start of therapy, to check for any alterations. Statins have also been accused of causing diabetes. Some research has found that the use of these drugs can increase blood sugar levels because they prevent insulin from working properly. Patients develop chronic resistance to this hormone and experience a progressive loss of pancreatic beta cell function over a long period of time, leading to the development of type 2 diabetes. However, a meta-analysis published in The Lancet reports that most new diagnoses of diabetes occur in people who already had basal glycemic markers very close to the diagnostic threshold for diabetes before starting therapy. Current evidence confirms that in patients at high cardiovascular risk, the benefits of using statins outweigh the risk of developing new-onset diabetes. In conclusion, we have seen that statins are safe and effective drugs, and the vast majority of people tolerate them well without any problems. A study conducted on over 135,000 people at risk of heart attack or stroke found that those who took statins were about 25% less likely to have a heart attack or stroke or die from heart disease than those who did not take them. Side effects of statins, when present, are usually mild and manageable. This does not mean that they can be taken without medical supervision or without careful evaluation of the balance between benefits and risks. It is therefore important to always follow the specialist's instructions and carefully monitor any symptoms. In addition, statins must be combined with a healthy and balanced diet, low in saturated fats, and rich in fresh fruits and vegetables. It is also important to practice regular physical activity, avoid smoking and alcohol consumption in order to keep cholesterol and triglyceride levels in the blood under control.